So your labs are normal. TSH, T4, T3, everything's within range. Your medication dose has been adjusted. And on paper, everything looks like it's fine. But you still feel completely broken. And I don't have to tell you what that feels like. The crippling fatigue, the brain fog, the anxiety, the weight gain, and of course, let's throw in the thinning hair and brittle nails. Maybe you've been told it's just stress or anxiety, aging, and if you're on this channel, you probably even heard hormones and perimenopause. But here's what your doctor didn't tell you. Your thyroid functioning fine and you feeling fine are not the same thing. Hashimoto's is not just a thyroid functioning problem. It's also an autoimmune condition. And that immune aspect of the disease is something that most people don't talk about. But it changes everything for how you manage it. I'm Erica Christine, and this is the Midlife Health Detective channel. Welcome back. Here on this channel, we take some of those pesky vague symptoms that are reflective of how your health is starting to dysfunction way before it turns into disease so that you can take back your power and reclaim your health. I have Hashimoto's, and right now I'm managing it without medication, and that could change. Not because I found some magic protocol or because I'm lucky, but when I was diagnosed, I refused to accept that this was my new normal and there was nothing I could do about it. I also started to understand exactly what levothyroxine does and what it cannot do when it comes to managing this disease. And this channel exists because normal labs and feeling great are not the same thing. And today I want to break down Hashimoto's into two components, because keeping them separate and focusing only on thyroid functioning is what's holding you back from feeling better. Most people, including a lot of doctors, think of Hashimoto's as a thyroid disease, but at its core, it is an autoimmune disease that targets your thyroid tissue. And that distinction matters more than almost anything else in this video. I want you to think of Hashimoto's in two halves. First, you have autoimmunity, where your immune system is dysregulated and starts to attack your thyroid tissue as if it's a threat or an invader into your body. The second component is the thyroid functioning, because after your tissue has been attacked, your thyroid functioning starts to be depleted. Half one is your thyroid functioning. The immune attack damages the thyroid tissue over time, causing it to function less optimally, creating a thyroid hormone deficiency. The deficiency is real, and the levothyroxine addresses that deficiency. It's a well-studied, effective medication that does exactly what it is supposed to do. One job: replace the hormone that your thyroid can no longer make. TSH going back into range means that one half of the disease is being managed. But the second component to this disease is the immune system, and this half rarely gets addressed. The immune attack is still happening every single day, quietly, and the medication doesn't touch it. It's sort of like having a plumbing issue in your house where the pipe is broken, but you're focusing on getting the water mopped up off the floor as fast as you can. You're treating the outcomes of the broken pipe, but you haven't addressed the broken pipe that is the source of the extra water on the floor. The same thing is happening with Hashimoto's. Your levo treats your thyroid levels, but it doesn't address the immune attack going on in your own body. So unless you fix the pipe or address the immunity, that mopping is going to go on forever. And even if you've had your thyroid removed for Hashimoto's, for nodules, for cancer, I need you to hear this specifically. A lot of women get a thyroidectomy, go on levo, and are told the problem is solved, your levels are managed, you're done. But the immune system that started the attack doesn't care that the thyroid is gone. It wasn't about the thyroid. It was about a misfiring and overactive immune response that chose your thyroid as a target. Remove the target, that immune dysregulation stays. The inflammation continues, and in some cases, the immune system redirects towards something else. So if you've had your thyroid removed and you still feel this way, this is why. Everything in this video is still completely relevant to you. So what does this ongoing immune attack actually do to your body? Your immune system produces pro-inflammatory signals. Interleukin-17 is one of the main ones, and these signals don't just stay in your thyroid, they travel throughout your whole body. That systemic inflammation can cross the blood-brain barrier. That's your brain fog. That's your fatigue that sleep doesn't fix. The same inflammatory cascade drives insulin resistance, which is why weight management becomes challenging and harder even when you're doing everything right. It drives joint inflammation. It contributes to the anxiety and mood dysregulation that often gets sent to a completely different doctor. In a systematic review in March of 2026, clinicians confirmed what we have been feeling: significant symptom burden in euthyroid Hashimoto's patients. This is women with normal TSH who still feel this way. It's driven by ongoing immune activity and inflammation, not by hormone levels. There's a second mechanism that most doctors don't explain to you. Levothyroxine is T4. That's the storage form of your thyroid hormone. But your body has to convert T4 to T3 in order for it to become an active form that your cells can actually use. The conversion is done by an enzyme called deiodinase, and that enzyme is directly inhibited by cortisol and high levels of stress. Chronic stress raises cortisol, not the acute kind, not the kind you feel when something scares you and then it comes back to baseline. Chronic stress is the kind that lives quietly in your nervous system when your life hasn't stopped being hard for several years. And that cortisol significantly impairs the T4 to T3 conversion. What that means practically is that you can have a normal TSH or thyroid stimulating hormone, a correct T4 dose, and still be functionally low on T3 at the cellular level. Your labs look fine. Your cells are not getting the signal. This is not a reason to add T3 supplementation on your own. It's a reason to understand why the standard panels is not giving you the full picture. Normal labs, real symptoms. They're telling you different parts of the same story. There's a test that many women stop getting once they've been medicated or once they've been diagnosed with Hashimoto's, and that's for the TPO antibodies. And there's a lot of chatter out there and a lot of discrepancy among physicians as to whether assessing TPO antibodies even matters. TSH measures hormone levels. That's half one. TPO measures immune activity. That's half two. Once you're medicated and your TSH normalizes, most doctors consider the case managed. TPO sometimes doesn't even get rechecked. Half two, or the immune component, goes unwatched and unmonitored. So ask for it. Specifically request TPO antibodies retesting, not just once, but periodically. That number tells you whether the disease is progressing, stable, or moving in the right direction. If it comes back elevated, that's not bad news. It's information. You can't navigate toward better if you don't know where you're starting from. So if it comes back normal and you still feel this way, that also doesn't mean that nothing is wrong. Some women are seronegative, meaning the antibodies don't show up in standard labs even when the immune activity is present. If that's you, there are other inflammatory markers worth looking at. That's exactly what functional labs are for. A negative result is not the end of the investigation. It's a reason to keep asking. I understood that feeling, being told nothing was wrong when everything in my body felt like something was. My response was absolutely no. Here's what changes when you understand this. You stop spending your energy optimizing your medication dose and chasing lab results. That's not the end all be all. What matters is how you're feeling. You start asking about the second half of this disease, the immune half. You start looking at what is actually driving the immune activity, because that is where your symptoms are coming from. For a lot of women, this is the thing that finally makes sense after years of being dismissed. The next video covers what it looks like in practice, the specific interventions with research behind them and realistic timelines. But before I close, I want to address something directly. I hear this constantly. I tried this. I managed stress. I lessened the exercise. I watched my diet. I cut gluten. I took this supplement for a few months. My antibodies didn't budge. Nothing worked. Two things. One, were you doing it long enough and consistently enough? 2 weeks of mostly gluten elimination while indulging in a bagel or a croissant or a muffin on a nice Saturday brunch is not going gluten-free. And 2 weeks is not enough time to see the benefit. Cross-contamination counts, so do cheats. Selenium and other supplements take time to accumulate in your body to reach optimal levels so that you can feel a difference in how they're performing. The research showing measurable changes in TPO antibodies is looking at 6 months to a year of consistent intervention, not a trial run. Second thing, and this is the most important one, your labs are not the only measure of success. How do you feel? Is the fatigue slightly less consuming? Is the brain fog lifting even 20%? Are your joints less inflamed? Are you sleeping better? How's the bloating and digestion and regularity? These are real outcomes and they count. TPO antibodies can lag behind how you actually are starting to feel, and some women see significant symptom improvements months before their labs reflect it. And some women who are seronegative will never see their antibody numbers change because the standard test wasn't measuring the right thing for them. You are not making changes to chase a lab number. You are making changes to feel better. If your labs didn't change and you feel better, that's not nothing. That's the point. Keep going. If nothing moved and you feel no different, that's information too. It means these interventions weren't targeting the right drivers in your case, and that is exactly why we investigate. So here's what I want you to leave with. The immune attack is real. The inflammation is real, but what's driving it is not the same thing for every woman. For some women, it's food, specific inflammatory triggers that show up 2-3 times a day, every day, quietly. And for many, that trigger is gluten. For others, it's dairy. And still for others, it's chronic stress. Not the kind that you feel in the moment, but the kind that shows up in the ratio of your cortisol to DHEA to melatonin, your body keeping score in ways you can't see without the right test. For others, it's gut inflammation. The gut and immune system are deeply connected. A disrupted microbiome is one of the most consistent drivers of ongoing autoimmune activity. Leaky gut really is not a wellness buzzword. It's a mechanism and it is treatable. For others, it's a sleep deficit that has become so normalized it stopped feeling like a problem. When you're chronically underslept, that reset doesn't happen, and HAF2, or the immune component, runs even hotter. You cannot fix what you haven't found yet. That's the entire point of functional labs, not to tell you something is wrong, but to tell you specifically what's starting to go off kilter in your overall health. And in this case, we're talking about inflammation in your body. So you're not guessing. So you're not eliminating every food and running every protocol and still not knowing whether any of it's actually working. If you're ready to take the next step, the link is in the description.